Hello, Dr. King.
Hi, Dr. Asim. I just finished my part of primes. Is this a good time for you to fill yours out and then chat?
Of course, we have our scheduled prime slot, correct?
Okay.
Okay, so I'm just gonna go through this. Okay, so I see your 3 goals here.
Mm-hmm.
Your first goal about piano, is there something specific about piano that you would like to cover? I'm not sure I quite agree
Sure.
with what you have. Not that I disagree with the piano portion,
Yeah.
It's a little broad.
Sure. So I think that had we had time this month to sit down, and I guess we spent a lot of time this month going over a lot of different topics, and we just didn't get to piano because that's the smallest part of our patient population, I think, at least with clinic. It would have been helpful to start with, I keep getting the mechanics of simple things like plantar flexion causes knee flexion, and then dorsiflexion causes extension of the knee, like simple basic stuff like that, that I should have down by now, but no one's ever gone over it with me. So and then we're just tested on it at the SAE, and I'm getting it all mixed up because it's not registered, and I don't have a great groundwork yet.
So let's say piano lower extremity.
Yeah, that would be a good start. Just like mechanical basics.
Yeah, mechanical basics.
And then, you know,
So
we
you're
go
really
into
talking physics.
Yeah, physics, exactly. Forces, like all the forces stuff, because we talk about all these fancy braces and orthotics, and that should not come before I know the groundwork, you know.
Okay, so specifically mechanics and physics of joints, lower extremity piano. Okay?
Yep.
Alright. EMG, that's a little bit broad as well.
So
specific
I think
EMG
same thing
though?
for me. I think this month worked on, and I feel stronger, have more of a groundwork in like the basics of nerve conduction study, and we were talking about the conceptual stuff and how I should think about things in my head. You and Dr. Kai have been helpful with that. I think we started it with our last patient, starting with the groundwork for EMG, but I've never had any EMG prior to this month here. So it would have,
Okay.
so basically continue to work on EMG groundwork and basically nerve conduction studies too. We've only had 1 month of that prior to this.
Yeah, so the definition of groundwork, I'm going
Or
to
I don't know if
say,
that's the best word.
we're going to focus on upper extremity. It has to be realistic, right?
Yeah, I guess upper
upper
extremity would
extremity.
be fine.
We're going to talk about median and ulnar and radial,
Mm-hmm.
nerve conduction studies. And what you're gonna work on is flow / montage, that's the word they love. Okay, that's a technical word.
What's that mean?
The setup
Yes.
is called
Just
montage
systematically.
in the books.
Yeah.
So when you're reading Dimitri and all those fancy books, it will be referred to as your montage. Okay. For that, there's actually a book I recommend for that, so I will show you the book after we're done.
Okay.
Musculoskeletal, that's again a little bit broad. And here I am going to put in a goal. I've discussed with both the other attendees on the service, and so we feel like you need to work on, does not align with your current goal, you need to work on your plan.
Okay.
Which also affects musculoskeletal, with your musculoskeletal medicine.
Yep.
Your plan needs to be more focused, and we'll talk about, more focused, okay?
Yes.
Okay, so I am going to write here, discussed, plan for more focused,
Like focusing on the
assessment.
rehab. Yeah.
Assessment and plan. Alright, so
Yep.
I'm going to sign, and then we will go over to see where we line up. Well, it didn't give me that option. we're supposed to, oh, here it is. No, we're supposed to look to see where we deferred. I
Yeah.
guess it did not go through. At any rate, well, we'll just go through it. So, in terms of, patient information gathering, you're doing quite well with that. You're on point. Again, the reason I wrote the assessment and plan to be more focused is so that actually as you're going in and you begin to evaluate the patient, try to think about that from the beginning of the encounter until the end. Because if you do it that way, then by the time you get to your assessment and plan, you already have it focused in your mind.
Yeah, that's a good idea.
Okay, so that's the first one. The second one is, the second one will be actually remedied if you fix the first one, which is, the documentation is a little bit kind of, loose. And once you actually have that, the documentation will fix itself.
So do you mean by loose as in, need to be more focused? So starting with the HPI and even the exam, like you said, the first step would be, okay, do I need to include that? Or the first step would be, do I need to do this exam maneuver? Or even ask my patient about that history question. Does this have to do with what I think, what direction we're going?
Correct.
So start there, and then from there, when I'm writing my note afterwards, yeah, like, don't just write HPI, write things that are more relevant to what we actually are going to focus on in our plan. I don't know if I explained that. Just
Not
more
quite. Your HPI actually is well constructed. What's happening is at the very end, I think, and this could be because you're in the middle of the learning process for these specific topics. Your assessment and plan and where you're going is actually appropriate. What happens at the end, it feels like it kind of loses a little bit of the focus.
Yeah.
And that could be maybe because your differential diagnosis in your mind is not concrete yet, which is expected actually for your level of training. So, but that doesn't mean that it shouldn't get better. So, you continue along that line.
Okay. Do you mean to just say spend more time writing a more focused assessment and plan?
No, you're not spending more time. It's a thought process.
Okay. So I should write out my whole thought process?
No.
Okay.
You should not. So you should abbreviate it to the common denominator.
Okay.
Yes.
Okay. So don't say all of my reasoning behind.
No.
Like I don't need to back myself up at this level.
So you're attending when you're speaking, yes, but
okay, not
when you're documenting, you're not necessarily.
Okay, because that will be evident in the HPI and exam that can back up what I'm saying as my diagnosis.
Yes.
Okay, I get that. Yeah.
Okay. Okay. So we went over that. Your physical exam are doing well. The next section I'm trying to remember. Is patient care. We don't have any concerns about that. Professionalism, there are no concerns. Can't remember the other two because we can't see them. But yeah, overall, that's the consensus with the attendings. There's three of us here, right? So we talk about it before I sit down to discuss this with you. And so they kind of agree with that same assessment.
Okay.
Okay?
That's
so
focused. It's good, yeah, sorry.
Yes. So continue your course of study as you are now.
Okay.
It is appropriate, the pace is appropriate, you've improved significantly here. The only last thing I would add is the EMG fluency. If you really can master that before your next rotations coming up, just practicing it on yourself, practice it on your colleagues until you kind of get that.
Yeah, but don't you think, I get stuck with EMG and nerve conduction. Yes, practicing, be able to go through the montage, like you said, that's important. I'm never gonna get a study done if I don't learn that. But I feel like right now, like P&O, I still need to have time, and I, need to get the time to get that groundwork still. Nobody has taught me like you guys have about you've spent time even when we're going through the EMG and physically doing it. You're telling me exactly what we're doing, why we're doing it, and all of the. We see onset latency is decreased. Why do we see that? What's happening to the nerve? like, yeah, it's one thing to be able to do it I can be a technician, but doesn't make me a good,
yes, okay.
so that's what I need to get down first is, so should I sit down with my book and do some study guides?
You
Like I
can,
normally do?
okay, so for that, Preston and Shapiro has, specific nerve by chapter, which could be helpful for you.
Yeah,
It's
okay.
a little easier to digest than
Yeah,
the
that would be good.
Mega Dimitru.
Yeah, I don't even know what book that is.
um,
Not there yet.
Right there.
Okay,
So,
we're not
yes.
reading that one.
Yes, so.
Nope.
So if you ever need it, it's right there
Good to know.
for your edification. But, yeah, I would do that, so we can go over that. And EMG, okay, I will be honest, EMG is a topic that will take you many, many years
Yes, I gather.
of feeling lost in the forest.
And falling asleep with my book in my hands is probably not a good start.
That is a normal thing for
Yeah,
most
okay.
residents. So, so we'll discuss techniques on that, as we go along, and I will show you the book, I will show you, the sections I recommend that you study. And once you study them, the next time you actually do an exam, remember the bullet points. What I used to do is put them on a little card and carry them in my pocket.
Yes, yes.
And then review it right before you go into the room.
Yep.
So those are techniques that you can use to kind of trigger your memory, so that you don't feel as lost.
That's how I learn
Just
best.
a little bit
Yeah,
lost.
yeah.
Yeah.
No, it's good. I feel like you and I have similar study techniques and how we learn, so it's been helpful to get your advice on
My pleasure. Any
mastery.
questions? Mastery, yeah. That's like lifelong. Any questions?
Not right at this moment.
Okay. Lovely.
Great.
All
Thank
right.
you.
It was lovely having you.
Nice to work with you. I'll be back.
Yes.